everyone. Welcome to our briefing on the coronavirus outbreak and its impact to health and business operations. Our first speaker is Courtney Kansler. Courtney is a Senior Health Intelligence Manager at WorldAware. She joined WorldAware during the height of the 2014 West Africa Ebola outbreak. Her background is combat-related traumatic brain injuries in U.S. veterans. Courtney also works as a licensed emergency medical technician in U.S. fire departments and has applied her expertise overseas in Zimbabwe and Guatemala. Courtney is going to provide an overview of what we understand so far about the coronavirus and the possible health risks to consider. Courtney?
Hi, everyone. So again, this is Courtney. So what we're going to talk about is what we know so far about the SARS-CoV-2 virus. Like all coronaviruses, this began with a zoonotic, that is animal to human disease transmission. The original source of this is, of course, under investigation. They were talking about cases that all had a similar history at a particular market in Wuhan in China. However, there's a bunch of different theories about, so again, that's all under investigation by scientists. The ongoing outbreak in mainland China has, of course, taken up a large portion of media energy. However, we do know that cases and deaths are likely underreported. There's also been some information come out recently about how especially death certificates are handled in China. Unlike here in the US or in other countries where, say you're an older person that has a heart condition and you contract coronavirus and you die later of a heart attack, but you also were infected with this disease. In China, they will just say that you died of a heart attack, but not necessarily also including this disease. So that makes it difficult for us to track appropriately these diseases. There has been some international sort of talk to Chinese officials saying, well, why would you record your deaths like this? It makes it difficult for us to track. And they say, this is just sort of how it's been done. We don't really have an interest in changing it. Sorry, which makes it difficult. So I think that the international community, the WHO and various ministries of health worldwide are certainly putting some pressure on China to perhaps make it a bit more clear when people pass away with this disease, but also have other diseases. So of course, that's just with time and international pressure. What we do know, the incubation period of this disease, so far, early studies indicate it's up to 2 weeks, and it's usually 3 to 7 days before symptoms appear. Roughly 80% of cases so far are mild in nature. That is per the World Health Organization. Typically, these symptoms include like a flu-like illness with fever, fatigue, cough, shortness of breath. This may worsen to pneumonia and in some cases kidney failure. This is primarily among older adults or those with chronic medical conditions and sometimes infants or young children. Chronic medical conditions are definitely something that makes it much more likely for a person to not only contract this disease, but also to have severe symptoms because it makes it difficult for your body's immune system to fight off a new infection like this. There has been, of course, imported cases in, I believe, 25 countries as of today. There has been limited human-to-human transmission with most of these imported cases, typically among family members, close contacts. So again, the interpretation of what we're seeing so far, there was a surge in cases pretty early on as disease surveillance and detection improved, but this also created a media frenzy, which therefore intensifies everyone's perception of how dangerous this disease is or not. It's actually really not that much of a problem for the average person. China did choose to change the way it was reporting new cases in mid-February. That was, I believe, February 11th. Instead of including just confirmed cases, i.e. those people who had positive laboratory tests, they were also including cases as people who had all of the symptoms but had not yet had a laboratory test, and they were also including people who had tested at least negative one time. I don't know why that is. They haven't exactly explained it, but I guess they're hoping that maybe their test isn't quite as robust in terms of making sure that they've found all of the people that they need to be saying that it's positive. So they're just trying to do that out of an abundance of caution. However, it is important to circle back and remember that seasonal influenza at this point still infects and kills more people globally every year than this disease. We have had some questions from clients asking, is there a risk in our supply chain, health-wise, for international shipping? If I send a package from my warehouse in China to my colleagues in Brazil or my colleagues in the US, am I infecting those people when they open this package? Do I need to incinerate, do they need to incinerate anything that I've sent them? Am I endangering my people? The answer to that is no. There is no risk. You can continue with shipping anything that you need. There is no health risk from that perspective. However, what we do want to underscore is that it's always important to report any sort of respiratory illness as soon as suspected, and do not take any fever-reducing medication to avoid transportation health screenings via air, rail, etc. This is how some people who, they're feeling a little bit under the weather. This was very early on in an outbreak, but they're trying to get out of China, or they had a previous obligation in a different country. They would just take, Tylenol, paracetamol, whatever, and get on the plane. And then they realize later, once they're in that new country, that they actually are infected. And now you've just brought it to a country that wasn't previously reporting cases of the disease. Please don't do that.
Thank you,
And
Courtney.
that's pretty much all I have from my perspective. Back to you, Mary.
Thanks, Courtney. Today we have special guest speaker, Dr. Geoff Tothill from International Medical Group. Geoff is IMG's Chief Medical Officer. His specialty is aviation and travel medicine. Dr. Tothill's early career included work in emergency medicine with a special interest in trauma management. He also worked with the UK's humanitarian operation in Sierra Leone during the 2013 Ebola outbreak in West Africa. Dr. Tothill is going to discuss prevention tips for the workplace and travelers. Thanks for joining us today, Doctor.
Thank you. It's a pleasure. Thank you for inviting me. Thank you as well to Courtney for that summary of where we are with coronavirus. I'm just going to, I've been asked to speak about protective measures, but I want to just emphasize a couple of points. As of today, 75,765 total cases worldwide, of which by far the majority are in China. Outside China, as of a couple of days ago, we had 804 cases outside China in 24 countries and 3 deaths. But to put that into context, as of today, 634 cases outside China were on a ship moored off Japan, the Diamond Princess. So by far the majority of cases that were exported at the moment are being seen on the Diamond Princess. It's too early to say at the moment whether there's sustained community spread. We're not really seeing sustained community spread outside China, apart from on the Diamond Princess. Elsewhere in the world, we're not seeing any evidence of sustained community spread. We're seeing, as Courtney said, some human-to-human transfer of the illness or infection, but really in close family groups or in other situations where people have been in close contact with carriers or people who are symptomatic. So it's too early at the moment to really understand how severe the illness is outside China. We know there's a mortality rate of probably between 2 and 2.5% inside China, but the mortality rate with the numbers that we're seeing outside China is very small, and only time will tell whether that increases. And also, we're not clear how quickly this disease spreads in communities outside China. So the jury's out on that. And WHO, the World Health Organization, their primary goal at the moment is helping countries around the world to put into place health protection measures to try and stop this virus spreading in their communities. So that's their focus. In terms of personal protection, certainly if you have people in affected areas, by far the most important thing to do to prevent the spread of the virus is hand washing. Good hand washing technique, regular hand washing will kill the virus on the hands. And the WHO and CDC and other agencies have good posters that can be put up prominently in work areas to show people how to wash their hands. You would think that was a straightforward thing to do, and it is, but often people don't wash their hands thoroughly. and it's the single most important thing you can do to stop getting infected. If you have physically clean hands, then alcohol is useful. I think it's over 70% alcohol gels used thoroughly on the hands will kill the virus, and that can be used as an alternative to hand washing. There's a concept of sneeze and cough etiquette, which was started during the avian flu outbreak. The WHO brought this phrase in, and it's about capturing your sneeze or a cough in the crook of your elbow, not into your hands, because then you transfer the virus onto your hands. So into the crook of your elbow, making sure that you distance yourself from people when you are coughing and sneezing, and you're not upset or offended if they distance themselves from you when you're doing that. So this is part of social distancing. Avoiding people shaking hands is important. And of course, although there's limited spread outside China, if you are traveling through affected areas, particularly airport hubs, we're not so worried about transfer on aircraft for various reasons, but through hubs, it's useful to perhaps pass through crowded areas quickly and board your flight quickly and not spend a large amount of time in large groups. So those are the sort of travel precautions you can take. I wanted to talk about mask use because it's quite controversial. In the Far East, there is a cultural acceptance of wearing masks. In fact, quite a lot of people you'll see in the Far East wearing masks, even if there isn't an outbreak. So it's socially acceptable. I would advise that if you are in those areas, you wear masks, but not because they provide much in the way of protection, rather more because it's socially acceptable. And if you're not wearing one, you may be criticized, but they are really not of any proven use in stopping catching this virus, because the mask is leaky and the aerosolization of the virus means that you're breathing in the virus around the edges of the mask. The other side effect of lots of people buying masks is that the worldwide supply of personal protective equipment like masks is dwindling, and the World Health Organization are worried that in certain circumstances, health professionals who do need to use masks in the right setting won't be able to get them. So they're stepping up the production of masks and distributing them to countries. Now, let's be clear, mask use in a clinical setting where both the patient and the healthcare provider are wearing masks and they know how to don them, put them on and take them off, are useful, but not as a general protective measure. So I would probably rule out mask use to protect yourself. So if we have the next slide. Clearly, if you have a contact center or you have a large concentration of staff who are coming together into one space and you're in an affected area, and of course, if this does become pandemic, that could be anywhere in the world. If we were to be unlucky and not be able to prevent a pandemic, then there are certain steps that you should take to prevent the spread internally. Clearly, these are all really under the heading of social distancing. Increased use of webinars, cancelling face-to-face meetings with clients and internally unless they're absolutely necessary, encouraging social distancing. People sometimes get offended if you don't shake hands, but not shaking hands should be encouraged. Splitting shifts is sometimes useful so that you physically separate groups of workforce, so that were one group to become infected and 2 or 3 people have the virus at any one time, then you would at least have a shift that hadn't been exposed to the virus. Sometimes that's helpful. I think during the last pandemic, most pandemic planning organizations reckon that about 30% of their workforce might be away either in the initial phases or the recovery phases of an infection at any one time. And so, 30% might be a sensible figure to work with, although we really don't have a clear picture of what that will look like yet. Remote working should be encouraged. Discouraging congregation, water cooler conversations, gathering for meals, that should all be discouraged. Make alcohol gels available on everybody's desks and get people to use them. And lastly, and possibly most importantly, there should be a published strategy, an HR strategy on absence from work. There is a bit of a culture across the world of what we'd call presenteeism. People need and want to come to work, and often they come to work when they're not well. But during a pandemic event, if they have coronavirus, they will be damaging your business and potentially infecting other people if they come to work. So staff teams working in these environments should be absolutely clear what the HR policy is, what the policy is regarding pay, remuneration, and the duration of absence, and what they should do during that period to keep themselves safe and self-quarantine, and also what the criteria are for return to work. So it's an evolving and interesting situation. And as I say, the threat to everybody worldwide is low at the moment. We just have to see how things evolve in the next couple of weeks. Thank you.
Thank you, Dr. Tothill. Next, we'll be hearing from Brendan O'Reilly. Brendan has spent most of his adult life living and working in China, India, and New Zealand. His main areas of expertise are China's foreign policy and its domestic socio-political dynamics. Brendan is going to discuss how the Chinese government has responded so far and what scenarios you may want to monitor.
Thank you, Mary. So I'm going to shift the focus a little bit here from the viral outbreak itself to the secondary disruptions that have arisen from official measures to control the virus. As I'm sure most of you are aware, all outbound travel from Wuhan and other nearby cities in Hubei province was effectively banned beginning January 23rd. As of today, February 20th, those measures remain in place. No one is allowed to leave Hubei province at the moment. There have been additional movement and business restrictions in other parts of China. So far, these have not been as severe as what has been imposed in Hubei province. And there is a fair degree of variation in terms of how local governments are imposing movement restrictions. In some places, authorities have been very proactive and they've forbidden residents from leaving their homes except once every 2 or 3 days to buy essential goods. That's in a minority of locations in China, but it is something that has occurred in some cities. In terms of nationwide measures, Chinese authorities extended the Lunar New Year holiday period to February 10th. Obviously, that has ended now. And there are widespread business and supply chain disruptions throughout the country due to both official movement controls and also increased social distancing. Many people don't want to congregate in public in places like restaurants. There have been some pretty severe impacts on industrial production. Again, this is varied by location. Certainly throughout Hubei province, everything is shut down. But in many other locations, staff are having a hard time returning to their places of work from their home provinces. Something to keep in mind is during the Lunar New Year holiday period, hundreds of millions of people in China travel. They often go back to their home regions. Additionally, schools throughout the country have indefinitely delayed reopening. We don't know exactly when they're going to open. And as I said before, certainly the retail sector has been in mainland China has been hit particularly hard. And of course, there have also been international travel restrictions. Several countries have banned Chinese nationals and or other foreign nationals with recent travel history to mainland China from entering their countries. Very quickly, I would like to talk about essentially we've only seen one official travel restriction imposed on locations outside of mainland China. Specifically in Israel, as of today, they are barring foreign nationals from Thailand, Singapore, Hong Kong, and Macau from entering Israel. I mentioned this, obviously, Israel is a fairly small country, but you can think of it as kind of like the canary in the coal mine. Israel was one of the first countries to ban travel from mainland China when the outbreak was reported. So it is certainly a strong possibility that we may see additional countries banning travel from areas where there have been significant outbreaks. Again, this depends on their political imperatives and the course of the outbreaks themselves, which, as Dr. Tothill mentioned, it's difficult to forecast at this time. But it's certainly not impossible that countries such as Singapore, Thailand, possibly Japan, maybe South Korea, could be facing the same type of travel restrictions that have been imposed on travelers from mainland China in the coming weeks. Another thing to keep in mind, just very quickly, it's something to keep in mind, thank you, is that there have been some internal restrictions on, say, gatherings of large people in places like Singapore. So far, they haven't shut down schools or anything like that, but things like Catholic masses, concerts, these types of events have been rescheduled or postponed or otherwise rearranged, which if these types of restrictions are further implemented or increased, we will likely see some secondary impacts arising from that. So now I want to talk about some forecasting specifically within China. So what should we be looking forward to in the coming weeks and possibly months in order to get a better idea of how disruptive this is going to be within China? So there have been some contradictions between the economic imperatives of the government, both the central government and local governments, and outbreak control measures. Chinese authorities have shifted, I would say within the last week or two, away from, okay, we need to be as draconian as we need to be everywhere in order to control the outbreak of the virus, to thinking more about, well, if we do have such strict controls, that is going to disrupt the economy for a long period of time. So there's something of an internal contradiction here in terms of how local governments are reacting, because they need to keep these two factors in mind. We've seen, as I mentioned before, we've seen some differences in terms of national level movement restrictions and control measures, and there's been quite a degree of localized prerogative in terms of how strict they want to be about banning gatherings. This is something that we haven't really seen, but I just want to keep it in mind in terms of something we should think about as a potential sign of a trigger or escalation point, would be tightened information controls. Obviously, there is censorship in China, and the government does control the flow of information to a large degree. However, it has not appeared that they have been especially stringent about cutting off communication from affected areas. So for example, social media platforms like WeChat and Weibo are still active in Wuhan and other places that have been particularly affected by the virus. There are videos coming out from there, which are sometimes censored or controlled, but they certainly haven't done anything like restrict all internet access in the worst affected areas. If they were to do that, that would obviously be a very negative sign that things might be slipping out of government control. And very quickly, I want to talk about the possibility for political instability and civil unrest within China. This is not something that I have seen at this time. There have been some localized protests in terms of people reacting negatively to movement controls in some locations, primarily in rural villages, and again, very localized. But something I want to mention is that the legitimacy of the Chinese government, the popular legitimacy of the Chinese government arises almost entirely from the government's track record over the past several decades of growing the economy and improving people's livelihood. And if this outbreak and the associated control measures are disruptive to the point where the economy is significantly impacted for a prolonged period of time, it's certainly a possibility that we may see more widespread civil unrest. This is not something that's happened yet. I would say it's possible the situation might begin to normalize significantly from early March, as many of the factory workers have 14-day quarantine periods after they enter specific cities. So it's possible the situation just begins to slowly normalize from March in most of the country. But if it doesn't, and there are severe economic hardships, the situation may deteriorate. Finally, I'd like to move on to talk about the potential for global impacts, and I shouldn't say potential because we've seen this already happen. So far, not in a major way in most countries, but certainly in some places it has been extremely disruptive. China, as you can see in this chart here, accounts for 16% of nominal economic output in the entire world. For many countries, China is their most important trading partner and a huge source of tourism revenue and investment. So anything that shuts down China for a significant period of time is going to have knockoff effects throughout the world. Specifically in terms of supply chain disruptions, I want to talk about the only good thing about the timing of this outbreak is that China basically shuts down most industrial production for the Chinese New Year period every year. Generally for about a week or up to 2, most factories are shut down as people return to their hometowns. So most businesses account for this annual disruption. And basically what we've seen now is that for many factories, production hasn't restarted. So these supply chain issues aren't quite impacting people yet, although there certainly have been disruptions, especially in South Korea and Japan, but at various industrial factories throughout the world. Energy prices have taken a big hit. China is the world's #1 importer of fossil fuels, and severe movement restrictions have impacted that demand. Obviously, there's been pressure on tourism, foreign education and hospitality sectors, especially in the Asia Pacific countries like Thailand, Singapore, Korea, Australia. It's obviously too early to say, and as I said before, it's possible that this situation may begin to normalize within mainland China from early March, although it certainly hasn't yet. But we cannot rule out some sort of systematic financial problems throughout the world as Chinese demand and outbound investment becomes disrupted for a prolonged period, if that happens. And finally, I would just like to mention very quickly that let's say in the worst case or near worst case scenarios, wherein China is significantly disrupted, through at least say the end of March or possibly beyond, if there are major global economic impacts, that will pose a political problem for ruling administrations throughout the world. Obviously, the state of the economy is very important for every government in the planet. Thank you, Mary.
Thanks, Brendan. Our final presenter is Hugh Dunleavy, Senior Vice President of Global Assistance and Response. He brings more than 32 years of federal law enforcement, U.S. military and private sector security and crisis management experience to WorldAware. He's a subject matter security expert with extensive senior executive management experience in protective operations and criminal investigations, risk management, major event security operations, and physical and technical security operations. He's going to discuss security considerations for organizations in China. Hugh?
Thanks, Mary. Good afternoon, everyone. As indicated, I'm going to focus my comments on security planning and preparedness. As our panelists have indicated, it is important to keep perspective here. In light of recent and constant media coverage associated with coronavirus, my comments are certainly not intended to be alarmist in any way. That said, we have seen unprecedented security measures, particularly in Wuhan and neighboring regions, in an effort to contain the virus. My comments here today are focused on basic incident management and planning considerations in the event some of these enhanced security and containment measures are implemented elsewhere. First, clients should ensure they are staying informed of significant events, monitoring internal message traffic, liaisoning with WorldAware through its Analyst program, and communicating regularly with local contacts to ensure they have current and accurate information on the ground. Make sure you are up to date on the locations of local outbreaks, quarantine locations, roadblocks, established curfews, travel restrictions, and major service disruptions to mass transit, as well as the availability of resources, food, water, medical supplies, etc. Be prepared for an increased security posture in an infected area. If confronted by security forces or law enforcement, make sure your staff and their dependents are compliant with all instructions and potential quarantine restrictions. Do not attempt to bypass or quarantines or checkpoint cordons. As was indicated, be prepared to establish a remote work capability to ensure your continuity of operations. Consider a work from home policy for the affected staff. Ensure they have connectivity, redundant communications, as well as backup power supplies. Affected staff in the region should register with their host nation's embassy if they have not already done so, and ensure your organization has developed crisis management plans, incident management plans, infectious disease plans, shelter-in-place plans that do not necessarily rely on host nation government support. And I'll touch more on that in a bit. Next, Mary. Mary, can you advance to slide 1?
I did. Is it not showing?
No.
Maybe it's frozen. It's on the go bag slide.
Yep.
Okay.
So ensure, with respect to go bags, as Mary mentioned, ensure your staff pack a readily accessible go bag so that they're ready to move quickly with little or no notice. The slide that Mary is about to provide or will provide depicts essential components of that go bag. In the interest of time, I'm not going to go into that too much, but be prepared to have required documentation. That's passports and visas, medical supplies, a supply of water and food for a brief period of time, and so forth. Something readily accessible that you can establish and take with you shortly. Thanks, Mary. Next slide. So establish and test a communication plan. Ensure there's redundancy to your comms plan and establish check-in procedures. Plan for a no comms contingency to include in-person health and welfare checks in the event communications fails or are overwhelmed locally. The requirement is to ensure that you know where your staff is in an affected area. You have their current physical address, a current detailed itinerary, and want to be clear, don't rely on an itinerary that was submitted weeks or months prior to an event. Establish a check-in procedure and ensure your staff in an affected region are actually staying where they indicated. Next slide. I'm going to touch on some high-level evacuation and shelter-in-place planning considerations. When developing these plans, we want to ensure that the evacuation is executed as efficiently and economically as possible. WorldAware attempts to take a phased approach to evacuation operations. WorldAware's evacuation operations generally include specific indicators and trigger points and clear instructions for all evacuees during every phase of an evacuation. When establishing the evacuation plan and operations, we need to ensure the accountability procedures. Thus, it is critical to ensure a robust comms plan, as was previously cited. Have well-maintained vehicles and transportation assets available. Ensure they are secured and staged for immediate departure. They should be fueled, have necessary emergency equipment, comms, water, inclement weather gear, and so forth. Ensure multiple and redundant assembly areas and evacuation rally points are identified with established safe havens that are mapped and well known to all staff in the region. Make sure critical staff in your organization are briefed and aware of those sites as well. Make sure you have sufficient vehicles and drivers to support your staff in these regions and transport all staff and their essential belongings. Redundancy is critical for and have a vehicle manifest. In the event a vehicle breaks down, consider requirements to cross-load staff and ensure that they all get to an evacuation point as indicated. Identify and consider areas of congestion or choke points. You should plan for mass evacuations and how that will affect your plan. How that will affect your plans. Have alternate and tertiary routes to avoid checkpoints or restricted areas to airports or transportation hubs. Some shelter-in-place considerations. Ensure the availability of potable water, ideally 1 gallon per day per person, and shelf-stable food supplies, optimally 1,500 to 3,000 calories per person per day. Ensure adequate personal hygiene requirements, toiletries, medication, trauma kits, and the training to use that medical first aid for all impacted staff. You need a plan for resupply as necessary. Have contingency plans for medication, food, water, etc. in the event that your shelter-in-place requirements extend for a prolonged period of time. Redundancy and contingency planning is critical. Regardless of the course of action taken, continuous analysis, timely decision-making, and prior planning are critical. And fully acknowledging that no plan survives first contacts, we need to be flexible here and provide options to react when operations don't go exactly as planned. WorldAware can assist your organization with prior planning, but ultimately organizations are responsible for the execution of those plans and deciding the appropriate course of action to ensure the safety and well-being of your staff. Finally, avoid relying on host nation local government support in any of your planning. Plan for self-support of your staff and do not rely on host nation, government, or local emergency or EMS support, as they may be overwhelmed or unavailable to you. Mary, back to you.
Great. Thanks, Hugh.
Question.
All right, thank you. And thank you to our presenters, and thank you everyone for listening in to our briefing. We will be sending a follow-up email to all attendees with a link to view a recording of today's briefing. If you have any additional questions, please visit us at www.worldaware.com, where you will find the latest information about the outbreak updated daily. Thank you for joining us and have a great rest of your day.